Inhale, exhale.
Yeah. Happy Friday, everyone.
Hello.
Hey, are we live already? Good morning, everybody.
Good
Good
morning.
morning. Good morning.
Good morning. Happy Friday.
Yeah, absolutely.
I feel
How
like
are
it's
you all doing?
Oh, it has been a long time because we didn't do last week. So
Yeah, those 5-week months.
Yeah. um, so anyway, welcome everyone. Thanks for tuning in. And we are back, the Proactive Health Collective of Keene. And we started this probably 1 year ago, I want to think. Is that right, Dr. Jean? This was your idea. This was your brainchild.
It was, just about a year ago.
Yeah, probably a little bit earlier, because I think we did it as soon as this all started. Probably by April we were doing this, I think. I wanted to think. I also wanted to make a correction. Dale reminded me that I didn't erase in my newsletter from today announcing this, that Dot Maver was going to be our guest. And so she was our guest last time. So any confusion there, and sorry, Dot.
And for those of you who can't get enough Dot Maver, you can check that out on YouTube.
Yeah, and if you're Dot Maver and you thought, oh no. Yeah.
That was just so great. I had an opportunity to catch that from home with the little one, and what a great share that was. So
Yeah.
I appreciated that.
yeah.
Speaking of the little one at home, how's all that going? For those who don't know, maybe Matt and Tisa Abatelli, doctors Matt and Tisa Abatelli, on March 13th gave birth to their first son, River Matthew, I believe, and he is one handsome cutie. He's bright, and he's beautiful. How's that all going?
That's wonderful. Yeah. He's really a joy. We're really just great things. It's a beautiful thing. I'm really glad to join the Father Club.
Yeah.
And and with that comes a whole new world. And I think that's a beautiful
Sunday is Tisa's first Mother's Day. Yeah.
It sure is.
That's right.
That's cool.
No spoilers here.
No.
I saw Dr. Jean's two little boys in the supermarket the other day.
You did?
Oh, that's right.
They are adorable. They are hilarious. They memorized what aisle the marshmallows were in, and they
Of course they did.
they were,
Priorities.
yeah.
Priorities.
Yeah.
I mean, joy is a part of health, right?
Yeah.
That's right. I get a lot of that.
I've been able to meet your kids too because of the sometimes when we go to the fucking great gathering on Thursday evenings. I didn't go last night. Were you there?
I didn't, but Kieran was there.
Yeah.
Hanging out with his friends, and then Castine showed up later, but I had a consult myself.
Yeah.
So.
Anyway. Okay.
Well, anyways, today we were going to talk about bone health. Should we give a quick introduction in case they're just joining us?
Sure.
We are a group of holistic healthcare practitioners in Keene, New Hampshire. And my name's Allison. I'm a licensed acupuncturist. We have Dr. Matt and Tisa Abatelli are the owners of Cheshire Wellness. They practice a special type of chiropractic network spinal analysis. We have Rebecca Montrone of Wondrous Roots. She is an herbalist, a nutritionist. You wear a lot of different hats, Becky. And we have Dr. Jean, a phenomenal kinesiologist specializing in gut health. So here we are. We share different topics every week, and we definitely enjoy your questions to try to make it as interactive if anything comes up for you. But today we thought we would talk about bone health. I came up with this topic because a family member of mine was recently diagnosed with osteoporosis, and she was a little bit freaked out about it. I think it's a scary sort of diagnosis, you know. But I reached out to Rebecca, as I often do, just for counseling. You know, a lot of my patients do have not a lot, but you know, you see it in clinic, but it's not something that people generally want to decide they want to work with acupuncture for. They kind of have their thing that they're set up with. So I think about like, you know, collagen chews, the Totem Voss ones are really great for that. But other than that, and, you know, of course, vitamin D, vitamin K, all that stuff that comes to mind, but I hadn't given it much thought. And Rebecca had sent me some articles that really opened my eyes to a lot that I did not know about the just osteoporosis, osteopenia in general, in terms of how it's diagnosed and different methods of treatment, and some potential, myths out there that are pretty commonly believed that may not actually be reality. So I thought it'd be a great topic.
Yeah. And I'm not sure, Dr. Matt and Dr. Jean and Allison, like you just said, people don't come to you for acupuncture thinking about strengthening their bones. They tend to not really think of it that way. And I'm not sure, I'm sure that keeping the network going of the nervous system is integral to everything. So, but the things that come to my mind and that I had said to Allison were things people don't really tend to know. And a lot of times the doctor who's diagnosing doesn't know and is working off what the American Medical Association kind of standard of care is for bone health. But the first myth I think that's really important to understand is that osteoporosis was determined as a condition by the World Health Organization when they randomly took the bone density of a 25-year-old woman and said that this is a healthy bone. This is healthy bone density. And so we know 25-year-old women have plenty of hormones happening and things like that. And we know that women, when they get postmenopausal, their bones tend to become less dense. But when we just randomly do a DEXA scan, a bone scan for bone density, and say that your bone density should be that of a 25-year-old woman, a large percentage of people are going to look like they have problems. Osteopenia would be like the forerunner of osteoporosis. Think of porous, right? Porous bones. Osteopenia, less dense. But there's also the whole idea that's come out in science saying that actually having less dense bones provides health benefits under the right circumstances. And so there's just a lack of understanding. We have, your bones, you're going to fall and break a hip. So you need to be on Fosamax or Boniva or one of these things. The one that your relative had been prescribed was Prolia, which works differently. And I honestly can't speak to it right off my head right now, but it did.
The side effects of Prolia are pretty similar to the typical side effects of the biphosphonate drugs.
Okay.
What is it? The degeneration of the jawbone, and then
Yes.
the fractures of the femur. And also it says in there that if you discontinue Prolia, you can be more susceptible to fractures. It just really doesn't really sit well with you,
That's a great marketing plan.
Right.
You can't get off of this.
Yeah, exactly. I'm going to share my screen for a minute and just take you to Green Med Info. Where do I want to do this? Let me just do this.
My understanding of these things like Fosamax, the way they work is that, in the bones you have osteoblasts, which create new bone, and osteoclasts, which break down old bone. And these medications, don't they basically kill your osteoclasts? Isn't that how it works?
Definitely, yeah. Yeah, so they're very counterproductive, but we're just even looking at some of the Fosamax. Okay, so Fosamax is alendronate, which is one of the biphosphonate medications. They all work, as Allison was saying, very similarly. Gastric ulcers, esophageal injury in users, ulceration of the gastric mucosa, prevalent subtrochanteric stress fractures, increased risk for atrial fibrillation in women, low energy femoral shaft fractures.
Yeah. What's so interesting about all of those things, Becky, is that if we look at the dates on that, I mean, this isn't new. A lot of this stuff is 20 years old or more.
That's what I think is fascinating too, Matt, because that's the way it is with a lot of things. You're like, this is not new. I mean, this has been known for a very long time. Mm-hmm. And still people are not being aware of that. I'm going to stop sharing that screen. I want to bring up, this one was really cool. This was published in, whoops, bear with me because now I couldn't get to my share screen. this one. And then I'll just blow it up. This was published actually much more recently, but you can't see where that is, but this is relatively new. And I don't know if anybody's familiar with this journal, Medical Hypotheses, but my father turned me on to this years ago. It is really excellent. And so a lot of times it's like we're thinking about this and why wouldn't this make sense? But this one was really interesting. And this is something I've never heard anybody say. Says there have been increasing numbers of reports that anti-osteoporosis drugs cause osteonecrosis. So that's like the jawbone necrosis that you were talking about, Allison, or other things. A typical example is medication-related osteonecrosis of the jaws, which can cause massive necrosis, and that's basically your bone is dying. That's what necrosis means, and defects of the jaws. Thus, the dosage and effects of anti-osteoporosis drugs should be re-examined. Our hypothesis is that primary moderate osteoporosis itself is beneficial for bones and should not be exclusively treated other than vitamin D, calcium supplementation, but I'm going to argue that, and functional exercise. It's the self-repair and anti-infection, and this is what Jean was getting at. Abilities of bone depend on its organic tissues, including stem cells, blood vessels, osteoclastic, and osteogenic factors in bone, which jointly fight against invading pathogens and repair bone damage. Recent evidence supports age-related changes in mesenchymal stem cell, including loss of self-renewal and increases in senescent cell numbers, that's old cells. Thus, the number of MSCs and vessels need to be increased to achieve functions similar to those in young people. This requires dissolving a portion of inorganic materials and providing extra space to hold more cells and blood vessels. In contrast, anti-osteoporosis drugs prevent bone destruction and increase mineralization that occupies the space of organic materials, reduces bone immunity and self-repair, Jean was getting at. Moreover, long-term use of anti-osteoporosis drugs also has negative effects on long bones and cartilages. Therefore, moderate age-related osteoporosis is natural in humans to protect bones. Excessive treatment of osteoporosis weakens immunity and self-repair.
Yeah, that's really great.
Yeah, basically in layman's terms, a lot of our immune system is functioning within our bones. And as we get older, this need becomes more, it's more necessary to keep, to fight off infection and whatnot as you get elderly. And so a natural aging process is for your bones to become more porous. So the space is more prevalent.
Where's the break point though, so to speak? No pun intended here.
I think very clever. Would expect nothing less. The thing is, what I always have told people through the years is we don't want bones super hard and dense. We want them flexible and strong. So I go at that by doing the same things you would do for your cartilage that you would do for your skin, your hair, your nails. That's collagen support. Okay, so we want things, so we use things like organic sulfur, MSM, vitamin C. These are raw materials by which we are able to make collagen on our own, and can certainly use collagen supplements. But the supplement vitamin D and vitamin K are super important because the D helps with the K to get the calcium out of the soft tissues where it should not be and into the bones. And this is why it's really dangerous, all of this calcium supplementation that people do for osteoporosis and for bone health, because I think I've said this before on here, but my father he was a pharmacist and he had sold supplements down at the apothecary. People would come in to buy calcium supplements and he would have them go on his computer and fill out this questionnaire, and it would show you how much calcium you were actually getting. And he would be like, you really don't want more calcium in a supplement form, because what happens with the calcium without the vitamin D and the vitamin K too, is that the calcium has to go somewhere. It has to come out of the blood because the parathyroid glands, nothing to do with the thyroid, but they're on the thyroid, next to the thyroid. They are very, very, have a critical job, and that is to keep blood calcium completely stable. And it has to stay in a very small range or health problems will ensue. So this extra calcium you're getting has to go somewhere. If your bones are not ready to receive it because you lack magnesium is another one. Magnesium, you lack K2, you lack vitamin D. And I would even argue in there bioidentical hormones, such as found in DHEA, is a huge bone strengthener because it converts to hormones that we know help with laying down that calcium and minerals in the bones.
It's a complex matrix. There's boron, silica.
Yes, I was just going to say boron. Yes.
There's so many different things. Yeah.
And all we think of is calcium. So people are being, I have that article from Green Med Info was one of the things I shared with you, Allison, is, we're being stoned to death. So people are getting,
Right.
too much calcium. It's not going where it's supposed to go. It goes into the arteries. It is the most abundant material found in arterial plaque is calcium deposit. Calcium deposit causes gallstone. It causes kidney stone. Calcium deposits can cause urinary frequency and urgency being in the genitourinary tract. Excess calcium can cloud the brain. So we've been going at this all wrong. Like the only supplement most doctors will tell people they need is calcium. And they tell them you need calcium and you need like 2,000 milligrams a day or 1,200, I think is the thing.
Right, and at face value, that kind of like, you could look at it through just a rudimentary lens and say, well, that makes sense. I mean, if there's calcium that's supposed to be in the bones and it's not in the bones, then we just need to simply add more calcium. But I think what you're alluding to, Becky, here is that it's a much more complex system than that, and that we need to think about it in a different way.
Yeah.
Yeah. Goes back to soil depletion too. We used to have all of these cofactors that we needed to put different minerals in the right places. And we just don't get that from our diet, even in organic foods a lot of the time. So if you're not getting those minerals, it's hard to utilize what you're taking. Just
Exactly.
because you're taking calcium, it doesn't mean you're getting calcium and it's going in the right place.
Yeah,
You know,
I think also something to note is that just like every other single health condition or challenge or concern that people have, there's always a multifaceted aspect to it. And, of course, we know exercises, strength, helps the bone grow, right? And so there's an aspect there. There's, not only, as Alice was just pointing out, the soil, but what if we don't have enough stomach acid, which is everybody, and we're not getting the nutrients from the foods that we eat? And what if our parathyroid gland isn't functioning right, which controls blood calcium levels? And what if, there's toxicity levels or hormone interrupters that are interrupting that? What if we're not getting enough vitamin D or enough vitamin K? I mean, there's all these different factors that come into play that, just bring you back to the same strategy as everything is, like, take a holistic view and check off as many boxes as you can, because it's not as simple as throwing something at it, like calcium or whatever.
Right.
Throwing something at it, trying to make something more static, right? So, I mean, isn't that what, this is a great one to share, Becky. I think if you take a look at what all of this is going to point towards, it's all going to point towards, in terms of the medical model, making someone more stable, making them, in essence, more static, and that if you look at it through the holistic lens, like Dr. Jean is saying here, you're going to see that, first of all, nothing's static, that your system's incredibly dynamic. It's always moving toward health or towards a dis-ease or lack of, which could potentially be a pathology, right? And so we have to think about that in terms of that we're not just trying to make you more stable, more static. And in fact, when you go down that road for too long, the first thing we have to do through an alternative lens is heal from that. A lot of people, it takes months to just get out of the healing from whatever medications they've been on before we start seeing results. I just had this the other day. Someone came in with their lab results, thrilled. Oh my gosh, things are getting better. She's like, I was starting to get a little concerned because it had been months and nothing had changed. Like, well, yeah, we had to heal from the medication first.
Yeah, isn't that interesting? An interesting thing to say, to heal from the medication. I was just sharing that briefly because this is another thing, because this is what we're talking about and what Dr. Jean was saying and Matt as well, but it's not just one thing, right? And here we've talked about, like Dr. Jean was saying, people don't make enough stomach acid. What is a prerequisite for making stomach acid is iodine. Most people are iodine deficient. So if you just even look at that, we see that you find body iodine status in women with postmenopausal osteoporosis is low. significantly lower. So what I like about this is that these are nutrients that we use for many areas of health. We use vitamin D and vitamin K2 for our cardiovascular health. We use it for our bone health. It's these things, iodine, we use for our thyroid and for preventing hormonal cancers and things like that. We use things like dehydroepiandrosterone, which is DHEA, a prohormone made in the adrenal glands, is also found to be extremely low in women with breast cancer, which seems to some people confuse them because they think I should stay away from all hormones. So, but these things, if we can keep them going, they are supporting not just one thing. It's not like I have to do a certain supplement regimen for my bones and a different one for my brain and a different one for my arteries. These things are missing, and exactly what Allison was saying. People think, well, I eat healthy food, you know, aren't I getting enough? Well, we just don't know. Somebody will say to me, I'll say, you need at least 200 micrograms, no more in a supplement form than 400 micrograms of selenium daily. Balance your iodine and to do all that. And they say, well, can I eat Brazil nuts? Well, I don't know, because I don't know where the Brazil nuts came from. I don't know what their quality is. I don't know how much to count on if you're doing it for something that really needs to be, you know, you're getting a certain amount. So I wish we could, but we're just not in the Garden of Eden anymore. That's for sure.
Yeah. Yeah. And it gets so overwhelming when you think of all the things you need, and then you're like, well, I need a supplement for this. And it's just so much, which is why there's people like Becky and Jean that can counsel you and figure out what your body actually needs. But I always revert back to your gut health. I mean, if you can make the most of what you're getting by having enough stomach acid, and you have the, you know, significant amounts of bacteria to digest it, you can get more from your food.
Oh, definitely.
Yeah.
And talking about bone health here, oh, go ahead, Allison.
Oh, no, you go ahead, and then I'll catch you later.
Oh, okay. Well, just so as a chiropractor, you know, we focus on bones all day long, and we're very interested in bone health. And I'm going to go back 100 years with this study. The Windsor studies came out in 1920. And what it was that it was 212 autopsies on people that had passed away. And what they found was that there was a near 100% correlation between whatever the diseased organ was, which had been credited with the, you know, reason for death, and the spine, and where the spine innervation came from. Because your brain continues down through your spine, all your bones, as a spinal cord, which should be called a brainal cord because it's all the same cells. And it hits a certain part in the spine and it goes to those particular organs. So the organ that had been diseased, there was a direct correlation and disease in the spine at the same place. So in that terminology, I mean, that's just a lack of, so we're looking at there's something wrong. So there's, you know, disruption of cells, deterioration, degeneration, et cetera, et cetera. But what we can say is that there's nothing in your body is an island, and that everything is connected. And that if we're going to look at, you know, if you start to try to manage symptoms, which in essence is trying to control your environment to, in fact, perpetuate a dysfunction that's already been happening, that has created momentum, the dysfunction is going to continue. That lack of ease is going to continue, and it's going to be whack-a-mole. Like, get this supplement for that, and get that supplement for this, and this for this, and this. And eventually it's like you've got so much gum in the holes and just the water's still coming through, you know. It can be, like you said, overwhelming. And looking at it through the lens that we're talking about here, and especially with people who deal masterfully with that supplementation, if I may say so, Rebecca and Jean, that, you know, going to see someone like that is really important to get a handle on that, because we're not meant to just stick bubble gum in the holes. We're meant to look at what's really going on and move you from that place into a place of optimal health.
Right.
Yeah.
You know, an interesting note on what you were talking about. It's kind of like a chicken and egg thing, by the way, with the spine, because you can have a viscerosomatic reflex, which is the viscera, the organs. If they're under stress, the spine will show stress as well. And so, you know, sometimes it can be the organ that's causing the distortion, or it could be the distortion in the spine that causes the organ to dysfunction and become more stressed. But it's really, at some point, it doesn't matter, because it becomes a cyclical thing where each are feeding upon each other. But I think, you know, I use that analogy. I use this analogy every single day in consultations. I talk about fish in a pond and say, you know, if you pulled your thyroid out of the pond and checked it and said, oh my gosh, the thyroid is toxic, what would you think about the other fish in the pond? Would you eat them? No, you'd say, okay. So you realize that it is a whole pond thing. And, you know, it starts with, you know, eating too much sugar our whole lives, for instance. You know, that starts the process of osteoporosis and other disease processes. But like Becky was saying, the beautiful thing is, like, if you focus on your health, you know, and it's an investment of your intention and your time and sometimes a little bit of money, but by focusing on this one thing, your health, as opposed to focusing on my thyroid and my adrenal or this or that, or I'm going to this guy for that. But if you focus on your overall health, no matter what happens, you're going to gain benefit in all the areas: bone health, you know, mental, emotional health, energy, all the things.
And it's not too late. Your body is always working for you. It's what it was built to do, and it's constantly repairing and regenerating, and even your bones will break down and build completely new with whatever building blocks you give them. I think it's 9 years or something.
Wow.
Like your organs, you're in a completely different body than you were in 10 years ago. So the decisions that you make are now, you know, no matter what decisions you've made in the past, can make such a huge difference.
Yeah.
If you look at your bones, I mean, there's like, they've got little arteries going into them. They've got little veins coming out of them. You know, they're producing all of your cells, basically. And the nervous system is innervated. Like, everything comes in and out of the bones. They are not solid. Going back to what you were saying earlier, Becky, so important. I think one of the most important lenses we could have when we think about health, and especially with something bone, which we think of as like this hard thing. And I just saw this funny article on National Geographic. They're like, bones are like programmed for 140 years or whatever. It's like, now that they think that the bones are programmed to last 140 years, which I mean, man, what a trip that would be, eh? You know, so there's just so much that's happening there. And if there is that space, then what is that space all about? Like, it's making space for different processes in the body, and it's
Bone
also
marrow
space,
alone, you know, our
bone marrow
human
alone.
bone.
Yeah,
Yeah.
and what I would say is it's holding information. It's holding information that is essential to your body being able to regulate itself. And if we fill in that space and that we tell the body what to do, that you need to be like this, and I, as the authority, need to make sure that your body does this so that you are well. Like, that's not it.
Mhm. Yeah.
I wanted to share one of the resources Becky sent me was talks about how bone mineral density is not the same as bone strength. And they give a really good example here. So I'll just read the whole thing. While there's a correlation between bone mineral density and bone quality or strength, that is to say they overlap in places, they're not equivalent. In other words, density, while an excellent indicator of compressive strength, i.e. resisting breaking when being crushed by a static weight, is not an accurate indicator of tensile strength, resisting breaking when being pulled or stretched. Indeed, in some cases, having higher bone density indicates that the bone is actually weaker. Glass, for instance, has high density and compressive strength, but it's extremely brittle and lacks the tensile strength required to withstand easily shattering in a fall. Wood, on the other hand, which is closer in nature to human bone than glass or stone, is less dense relative to these materials, but also extremely strong relative to them, capable of bending and stretching to withstand the very same forces which the bone is faced with during a fall. Or take a spider web. It has infinitely greater strength and virtually no density. Given these facts, having high bone density and thereby not having osteoporosis may actually increase the risk of fracture in a real life scenario like a fall. So like Becky was saying in the beginning, it's possible that these drugs are making your bones more brittle, but not actually stronger. Because density is not the only thing that decides if your bone's going to be strong. Yeah.
Exactly.
Mm-hmm.
Yeah. So there's a big difference. And and it's not hard to do. I think that's the good thing too. Even if we're talking about supplements, these are not expensive supplements. Vitamin D is not expensive. Vitamin K2 is not. You can get a bottle of DHEA for 25 milligrams a day for $16 for 2 months. It's not, these things aren't hard to do. It's not like, oh, I can't afford that. It's just making sure you're getting them. I think is the thing that I like about supplementation is that I don't have to say, you know, was I in the sunshine today? How well do I convert vitamin D, sunshine, UV light to vitamin D, that kind of thing, or did I eat enough of this? You know, it's just a good way, just kind of a good insurance to make sure you're getting certain things that help. There's also another article here, the Stone to Death. Allison was just reading from that, osteoporosis, the dangers of high bone density. This is the Stoned to Death. Hang on 1 second. So Stoned to Death, calcium supplements proven to kill again. That's a very interesting. Those participants who took a regular calcium supplement increased their risk of having a heart attack by 86%. Oh, and let's talk about that a little bit. So Coumadin, right, or warfarin, which is a drug that's commonly, you guys, I'm sure, you know, your patients and things are, you know, people who are on those medications. People who are on Coumadin to keep from having a heart attack because they have atrial fibrillation, or actually it's usually to keep from having a stroke. By throwing a clot if you go in and out of cardioversion of your heart rhythm, right? But the people who are on those medications have to very carefully avoid vitamin K. And vitamin K is found in a lot of healthy foods, leafy greens, you know, you name it, they got to stay away from healthy food, vegetables, you know, a lot of your vegetables. And people on Coumadin, warfarin, have a higher incidence of heart attack because they cannot get the calcium out of their arteries. And so, you know, you're having somebody take this medication that, I don't know if any of you, anybody who knows anybody who's been on warfarin, you got to keep going, getting your INR tested and make sure it's in the right range. And that's a hassle in the first place. You got to take the medication. You can't eat healthy food. And guess what? You're going to have a greater chance of having a heart attack because you're on this medication to keep yourself from having a cerebrovascular event. It is, it's sad.
This is the classic, what they call unintended consequences. It happens, you know, a lot in medicine, right? But it happens in life too. You know, you build a dam here and you find out, oops, we screwed this up. Or you kill off all the coyotes and you find out that the field mice are now running wild and raiding the grain, you know? So it's the classic thing of like, you know, if you're not looking at the big picture and you just hone down in this one little piece, and that's mechanistic versus holistic or vitalistic, then you always run into these problems. And, you know, it's not just that these drugs are, you know, like that they're chemicals and that represents a toxicity, but there's a balance, there's a harmony in how the body's working. And then you go in with your like sledgehammer to a fine piece of jewelry trying to make corrections, and it always lands up with another problem, you know, just like we talked about the stomach acid. People start to get reflux, they start to take more antacids, which makes them feel a little better, but then they absorb less nutrients, they don't break down their proteins, they have rotting proteins moving through their gut. Just an interesting thing. It's like no matter where you look in the field of medicine, it seems to be like that, like tunnel vision to this one thing, and then whatever happens to the rest of the stuff, well,
right.
We didn't think
there's
about
a
that.
reason that's happening, right? There's a reason that like low stomach, there's or over stomach, or whatever it is, you know, take the antacid. Like there's a reason that you are reaching for that antacid. Let's take a look at that.
Yeah.
And a really important thing to point out too, so on this, you know, the kind of bigger picture of things, we're scared of osteoporosis because if you fall, your bones are not as strong and then you're more susceptible to a fracture, right? And I think we really need to address, why are people falling? And especially in the elderly population, so many elderly people are extremely dehydrated. And then it doesn't, I think as you age, your body is less capable of absorbing the water. So even if you're drinking a lot, you have dehydration as an issue. And then you have people that are taking a lot of different medications, and the side effects of those will often cause dizziness or vertigo and just imbalance. So I think that's another big factor in it. Working on your balance, staying hydrated, getting the electrolytes and the minerals that your body needs to maintain that balance and that cognitive function.
There's also, along those same lines, keeping your large muscles strong, doing squats, things that keep your quads and things, because when people get older and their muscles atrophy, they have a harder time just even getting up off the toilet. You got to use your legs to do that, right? I mean, things like that. So if you don't have strength in your large muscle groups, you don't have the support really that you need. So again, it's a whole body thing. It's not a magic this or a magic that.
So
And what we
I've
know
heard-
too is, oh, go ahead, Gene.
I was just quickly, I've heard this, and I don't know if it's true or not, maybe one of you do, that a lot of times when people, elderly, break their bones, that, and they fall, they blame it on the fall, but it may be that they broke their bone
And then
and
fell.
fell because their bones snapped.
Yeah, and so, hand in hand with strengthening the large muscle groups is something that's becoming very common knowledge now, thank God, which is that weight-bearing exercise contributes to bone health. Undeniably so. If you stress something in the body, it will get stronger. So if the body is feeling as though it is compromised in any way, it'll make it stronger. That shows up as scar tissue, which is one form that is not necessarily beneficial. That also shows up as increased bone density, and not in the just make it more dense, but in the complexity of still having healthy space and the integrity of the bone itself, while becoming more like you said earlier, Becky, flexible and strong.
Yeah.
Same.
No, it's good. Oh, I was just going to show you this briefly because I have it here and I can share my screen. But this is the thing on that thing about Coumadin. Numerous health experts have been concerned for years that Coumadin was not effective in preventing vascular deaths, but it also has problems with occasional serious internal bleeding episodes. German researchers found out in 2005, there we go again, Matt, that long-term use of Coumadin produced increased calcium in the aortic valve, coronary arteries when compared to patients not taking Coumadin. Dr. Gary Gordon states that every patient on Coumadin is increasing the calcium content of all vascular tissues. Calcium content of arteries is now proven to be more dangerous than diabetes, elevated cholesterol, or hypertension. We must now try to educate patients. So again, going about things all wrong, causing more problems. And we're seeing that, can't get through a thing in these days without mentioning the whole COVID thing. But this is what we're seeing with that whole thing. As we keep going down that path and trying to use different things and not using the things that work and using the things that don't work, we're finding, and I think we're going to see more and more, and we're going to be seeing more down the road, problems that we cause, that were completely preventable, that we cause while trying to address one issue.
The question is just whether they're unintended consequences or not, right?
Right. Well, I told you. I won't go into it. I won't. Sorry, everybody. I'll spare you.
We opened it, we're gonna close it right back up.
Yep.
Back up.
Feel free to tailgate afterwards if you like.
Yeah.
Yeah.
One thing is that, as Rebecca was saying in the very beginning, you have the T-score is the diagnosis that you're given if you have osteoporosis. And what it is, it's basically how you compare to the standard bone density group, which is based on females in their late 20s, early 30s. And actually what's really interesting about that group alone, there's like a bell curve, which is the standard bone density. And in that curve of these, younger women, you have 16% of them already have osteopenia by that diagnosis, and 3% of them already have osteoporosis. So you're already starting off with that, with that in mind. So the T-score is how you compare to that group, but they have something that's called a Z-score. So if you have been diagnosed with osteoporosis or osteopenia, you could ask your physician what your Z-score is. Hopefully they might be able to tell you, but it compares you to your age group and your ethnicity and your gender as well. So it's more accurate in terms of where you stand in comparison to others with your bone density.
And that's an easy Google thing too. I mean, anyone, you can look that up, right?
Oh,
Yeah. And I've got that actually on my screen too. Kind of, I think that's the article that you're actually referring to.
Yeah.
Yeah.
So Matt, you think you can there's somewhere you could convert your T-score to your Z-score?
No, that is out of my jurisdiction, but
Okay,
that is
yeah.
something that you can easily look up online. If you do a quick search on that, it's going to give you the different graphs and show you what's what in terms of like the ethnicities and all of that.
Oh,
What's
gotcha.
normal, et cetera. Yeah.
Yeah.
And what I can say from, looking at thousands and thousands of x-rays is like, yeah, bone density does change over time. That's a fact, it does. And that we shouldn't consider just a decrease in bone density as an overall indicator of your like whole bone health, and that's one aspect too. And that's something that we need to look at in conjunction with so many other things. And that it's not a single quick black and white answer. It really comes down to what's the root cause, why is this happening, what are things that we can do to strengthen the whole system, how can we heal, how can we move from a place of where you are now to a place of optimal health. Like that's what everything comes down to, is that everybody wants to live to their fullest, and we're knowing that what's that?
Yeah, I was just to say, I say the same thing every day. It's like whatever health problem you have, it's a result of lack of health. Whatever it is, no matter what it is, it's a result of lack of health, right?
Yeah. And we say that, and then I follow that up with, and what you've been doing isn't working, and that's why you're here. Really, so it's time to get some. I had a mentor I used to say, get some different results. I loved that.
Yeah.
That's awesome.
Cool. Is there anything else you guys can think of that I'll talk about? Weight bearing exercises. I believe for bones, you really want that like pounding, whether it's like jogging or something, because it's about the like conductivity kind of vibrates. Bones are made of this crystalline structure, and that's actually how you strengthen it. So like boxing or things like that, I've heard are very effective for strengthening your bones.
Yeah, and I think that you can't talk about that without talking about the alignment of the spine and even just the extremities, right? So if there's a misalignment in the spine, which is ultimately caused by some neurological feedback that's holding the system in a poor posture, if you get out there and start really load bearing, you have the potential of causing some distress in other parts of the body. So I would say, consider all of those things. And if you have it in your wheelhouse to be able to see someone who focuses on the spinal health, great. And if not, then focus on as much awareness of your posture as you possibly can while you're doing that. It's not more is better. Like the no pain, no gain mantra is not where it's at with this one. It's definitely about increasing awareness and then moving from there. Yeah.
It can be challenging too. I think, again, it's not one thing, but it's a contribution from different areas that you're talking about, whether it's, your toxicity load, your nutritional levels or absorption, your exercise. The challenge with a lot of people when they get, on into their, say, senior years, and now they start to become concerned about this, because the truth is most people that are younger aren't, right? Until you get a little older. But then the joints, a lot of people's joints have taken a beating. And so the pounding, you have to kind of weigh, like, is that going to be the most beneficial thing for me, based on the damage that is already occurring in the joints. So.
Yeah, I mean, it's all about performance. It's all about momentum. I'm really happy to say that we have an increasing younger clientele in our office. And generally speaking, those are the people who are looking for performance. They're the high performance athletes, people that are looking to really maximize what it is that they can have. And so may that not be limited just to the athletes, to like our top performers. May that be something that we can all engage in wherever we are in life. And like you said earlier, Allison, it's never too late. It's never too late. I love hearing, I mean, we have practice members who are in their late 80s who are just, you know, they're getting stronger, more flexible than they've been in decades, you know, and I love seeing that. It's never too late.
Yeah,
Mhm.
I'm gonna share this. I just was looking, just quick. For the best
There
exercises,
you go.
strong bones. So we have running or squat jumps.
And this is, where is this? This is coming from Prevention. Is that where it's?
Magazine, yeah.
Yeah, there you go. So there's a staple in the industry.
High intensity exercises or jumping jacks, like Allison was saying. Weight training or simply doing a deadlift. And yoga. Very interesting. Yeah, that makes sense, right? Because you're doing so much different stuff with that. With yoga, you're strengthening and you're stretching and you're doing all those different things at the same time.
And all those muscles that you need for balance as well, so you can prevent falls at the same time.
Mhm.
Qigong is very big for prevention of falls and maintaining your balance. It's there's 5 branches of Chinese medicine. Exercise is one of those branches, and Tai Chi and Qigong is kind of the Chinese version of that.
I've heard of somebody doing, recommending that, and they were doing a class before all of the COVID stuff happened somewhere in this area for Parkinson's, people with Parkinson's,
Yeah. Mhm.
and Tai Chi.
Yeah. It's nice because you're using your breath with your motion. And what else was I going to say about that? You're also at the same time opening up all these energetic pathways in certain ways. So you can you can do it specifically for the kidney element, or the water element, which is the kidneys, which governs the bones. And then you would open up the pathways that circulate this energy through that meridian, which is the inside of the legs up the center line of the chest. So really basically right over the vertebra.
Yeah, which is also where your vagus nerve runs.
Right.
I mean, you think about a practice like that, the benefit of that. I mean, you're conditioning, you're basically like training your nervous system. We could take that practice and also look at it and lay that with our what we call functional neurology, which is basically like, how is the body holding itself? It's huge with posture. A lot of those tests is done blindfolded, as an example. You know, like if you're blindfolded and you march in place, does your whole body start to rotate? You know, if you try to touch your finger to your nose, or you somewhere out in left field or whatever, you know, that's all just misfirings in the nervous system. You have practices like that are ancient and have been around for a long time for a reason. There's wisdom there.
I know. I remember. Oh, sorry. I was just
quick. Oh, sorry.
No, go ahead.
Okay, yeah, just to follow up with that. So the kidney meridian will go over the vertebra, and the water element, the kidneys also govern your adrenals and your stress response. So it's all saying the same thing in a language that was created thousands of years ago.
This is what I was going to say, and this goes right to what you're saying. So when I would travel, I traveled a couple of times with Dale to Taiwan, and you would see people in Taipei be looking down out of your hotel in the morning, and people would be in the middle of on the meridian, right, doing this kind of stuff. This was like exercise. It did have something to do with the kid. I don't know, but it didn't look like they were doing much of anything. You just were kind of like, you know, what the heck? But they have these series of things that are very good. And it doesn't, we're used to, going to the gym and working up a sweat and doing all this kind of stuff. And I'm not saying they don't do that, but I know what they were doing. There was a purpose for it. It just looked different than anything I'd ever seen.
Yeah. Yeah, it's true. Like a common one. So you can do, I think it's called knocking on the gate of heaven or something. And you just start.
Yes, they do that.
Really nice one to just start off, and you're loosening everything up here. So you're getting the circulation flowing, and then you're also tapping right on your kidneys. So that's your, and then you're using your breath with that too. And you can do,
Yeah, they were doing that. That move was in there. Yeah.
Yeah, it's all type of them. They're really nice.
We like to say motion is lotion. Motion is lotion. So if you got, aches and pains, like, hey, keep it moving. Keep it moving.
True. We didn't talk too much about stress, just stress in general. Like most things, stress obviously is a natural process, and our cortisol levels go up, and it has effects. And they're meant, you're meant to have that as a short-term strategy. When those cortisol levels are staying up, it does a lot of things. It affects, the hormones, like in the pregnenolone steal, for instance, where, you take that base hormone and you're using it for your stress hormones versus your other sex hormones. But in the case of bones, it would affect the bone activity as well.
Oh, it absolutely. And if you think about just biochemically, I mean,
that's what
like it's going to start doing all sorts of stuff with your bones because it's going to start pulling resource to basically run the system in overdrive.
Right. And so you have more bone loss and less bone building when you're in stress mode too. So again, it just brings us back to the same concept of like, okay, I actually want to pay attention to all these things collectively. And that gives me, the best support for my system versus focusing on just one aspect of any particular thing.
And that is so important. So like just going back to, talking about Tai Chi and Qigong and like all of these, like there is wisdom out there, folks. Like seek it out. And then we will come up against the like, well, there's how many people out there right now, like how many people have something on your list that you should be doing or that you ought to be doing that would be good for your health that you're not doing right now, right? Like, yeah, raise your hand, and the truth is like, it's probably more than one thing. And there's a reason that you're not doing it. And the reason that you're not doing it is because you simply don't have access to the energy that is going to take to drive that type of behavior to whatever it is, to whatever the degree is that you need it. So as we're looking at this whole big picture of health here, and we're starting to look at, what are the root causes of some of these things, we can't not look at stress physiology like Dr. Jean is saying, and then we need to apply that toward what are the constructive things we can be doing, because there's a reason that we're not doing it. It's not because it isn't a good idea. The New Year's resolution doesn't fail because it wasn't a good idea. It fails because we don't have the energy to sustain it. So start finding out what's that?
We just don't want to.
Right. And so that's a whole nother thing, right? We call that duck and cover. That's what we call that. Like, I just don't really want to do it. And that's actually a form of not having enough energy too. That's actually a sign of stress physiology.
I wanted to go here, if you don't mind, I want to share one more time because Jean was talking about the adrenals and the cortisol and the stress and everything. Here we have DHEA. We've been talking about that. That's made in the adrenal glands. So when people are too high stress and cortisol, DHEA can be a really good balancer of all of that. But here we have osteoporosis like a football, certain dietary load, boron, we talked about all of that. Among the anti-aging hormones, DHEA stands out as a multi-talented star with amazing ways of outsmarting osteoporosis. Inhibit bone breakdown and stimulate bone formation. So see, this is totally different than like Fosamax. This is like totally different. It's a precursor also to estrogen, progesterone, and testosterone also, which help. It helps convert, so we see that there too. And what happens to people as they age, we start making less DHEA around age 25 to 30. And so DHEA is something that we can healthfully do to really strengthen our adrenal glands and then have this nice effect, a healthful effect on the bones, a natural support of the bones, not a false, cementing of them. That's what I think about those drugs. It's just like turning your bones into cement is what it feels like to me. Yeah.
We need some stability in life, right? It's like if you have too much instability, like you're flying off the handle all the time, like that's not good, but too much stability isn't good either. Like how many people love variety? Like we love variety. We love something new. Like we're enchanted by new novel things, like the next shiny object or whatever it is. And like your physiology is no different. It requires both stability and sort of like a solidity, but it really does also require some variety and some flexibility. Yeah. And that is growth. It's like we know that there cannot be both growth and protection happening in any living system at the same time. They're not congruent. And it's not like, oh, part of me this, part of me that. And it's like we're governed by the same laws that any other, animal or plant on this planet is. Like that's the same thing. If a plant is too stressed, it will not grow.
Yeah.
Cool.
So stress those bones.
So stress those bones. What do they call it? They call that eustress, right? Wasn't there that
That's
whole
right.
thing?
Good stress. You stress.
What is good stress? Which I think, like I might like kind of like to disagree with that whole concept, but I sort of get where they're going with that one. That stress can be good if it's constructive.
I think fear can be good. Like it motivates you to make changes and be prepared. Stress is, I don't know. Stress is like when I think of stress, I think like just an unnecessary byproduct of, not seeing fear for what it is and making up stories about what it might be. I don't know.
I think on a real like basic level, fear is like the most primal thing. Like somebody's attacking me with a knife. Of course, I'm going to be in fear and, deal that.
Yeah.
And, unfortunately for a lot of people, it takes getting to the point in your health where you're fearful to be able to change. But I think, and Matt would probably agree with me on this, as you can get to higher levels of consciousness, you're making decisions, in a proactive way. Like it just makes sense to take care of myself. I don't have to wait till I'm in fear of losing my life. I'm going to stay a little above the curve here and, make decisions from a different place, but definitely can be a motivator.
I would say too, I do think that demanding life challenges that provide us with stress can be very beneficial. They make us stronger. They make us realize that we're more capable than we thought we were. They challenge us. They do make us stronger as people. I think they refine our character and things like that. It's just how we respond to them, how we handle them. So I think even just life stressors like having a new baby or, whatever, just regular life stressors do make us stronger if we take and use them properly.
If you never know pain, you can never know compassion.
That's true.
Yeah.
Right? So we have to experience all the different things in life for the contrasts and for the opportunity to grow. Because if you're totally comfortable, why would you change? Right?
It's a cost of admission of being human.
Right. I saw a meme recently. It was talking about like, everything is hard. Marriage is hard. Divorce is hard. Choose your hard. Work is hard. Work is hard. Being unemployed is hard. Choose your hard. Like everything in life is hard. But you can choose how you want it to be.
Yeah.
Stress and
It's a
everything.
little sad, but it makes sense.
Yeah. Matt told me once though, it's life does require effort, but it doesn't have to be a struggle. I like that. Think of
Yeah, I
that.
like that too.
True.
All right. Well, these are some words of wisdom, I think, that maybe we can run with for the weekend.
So yeah, we have a guest next time on the third Friday?
Yeah, we do. I'm reaching out to Joe Mabe of Hyperbaric Fitness, but I haven't heard back from him. But I have a feeling that will happen. But I'll find out as soon as I can. I actually put a call in and left a message this morning. I emailed him earlier this week, and I'll let you know ASAP.
Awesome, because I'm looking forward to learning more about that.
Yeah.
Regardless, we will have an amazing program for you in 2 weeks.
That's the 21st. So thanks for being with us today, and appreciate it. And same to you, all my wonderful colleagues. Give our best, give our love to Dr. Tisa and River, and be well.
All right. Stay happy and healthy, everyone.
Take care,
Bye.
everyone.